My grateful thanks to the Department of Human Genetics and the Andhra University and the organizing committee for this symposium. I feel it's a privilege to be in front of you, and today's experiences are really pleasurable. And most important is when you share knowledge, your understanding undergoes a profound change. That is the transformation I got while preparing for this talk. There are a few things which I want to say is in this lecture, I think I and Deborah will be covering similar concepts, but I'll have a lot of illustrations so that will help you to understand, and you can interrupt me in between also for clarification. I don't have any objections. So when you look at this figure that's by the thing, you realize it is this figure is this figure is drawn out of two lines, and human body is not as simple as that. And if you look at this figure, this is one set of line diagram, and if you look at this diagram, this is the second line. But human body and human behavior is not as simple as that. And in this journey, I'm going to take you about what is biological sex, what is gender identity, which is questioning our fundamental understanding. A major milestone has happened in the WHO classification of disease in 2019. They separated gender identity from mental illness to a sexual health issue. So when you look at the year 2019, the whole change is 4 years. And we are confusing the terminology of 10 years back, 5 years back, and post 2019 terminology. And then we are using different terminology, not defining what the speaker is saying about the terminology and which year is the terminology coined. In the process, we're adding layers and layers of confusion. So a milestone in the transgender history occurred in 2019 when the WHO organization removed gender identity disorders from the chapter on mental illness in International Classification of Disease and replaced with a new diagnosis called gender incongruence in a new chapter on sexual health. This basis forms the foundation of understanding. And whenever we discuss anything, we should ask, is it pre-219 or post-219? So that we are all speaking about same language. As we look into history of science, a lot of times discoveries happen, but the terminology may not be the same. In the process, a lot of valuable time is lost. And I feel this statement is of profound importance. In this outline, I'll be basically speaking about the biological sex, definition of sex, gender identity, basis for biological sex, how hormones and genetics play a role, which is really different from transgender female and male, and what is the correction mechanisms that happen. When you look at the prevalence of the whole system, the prevalence of transgenders is between 0.02 to 1%. That means when we look at a 2 billion, 7 billion population, you might have a huge number of people which are not identified. And surveys on transgender varies from 0.3 to 0.5% to all types of transgender to 4.5%. That's a huge number. But when we come into the actual population, we are not seeing that number. That means we are not identifying that group of problems. When you look at understanding, I ask one particular question in the audience, is a person who's producing a sperm is a male? That is being fundamentally questioned now. Is a person that is producing an egg is a female? That is being fundamentally questioned in this concept. So are sperm producing persons male? Are egg producing persons female? This is a fundamental question we have to understand before we discuss about transgenders. Then when you come to the context, if you are looking at an XY embryo on day 5, that is a possibly male embryo, will it lead into a birth of a male child or a female transgender or an intersex? There is a long journey between the embryo to the development of the organ, to the birth assignment, and also to the gender assignment. we are losing clarity that our fundamental understanding should start here of sex and gender. So I repeat it, when it comes to an XY embryo and the fifth stage, on the fourth or fifth day of life, even though it is genetically male, it has to undergo development of the internal genital organs, development of the external genital organs, and be born with an assigned sex. Sometimes if there's a Mullerian inhibiting hormone deficiency, then what happens is, then the uterus and the ovaries are not regenerated, and this male will have a uterus and then a vagina. Then at birth, that child is assigned as a female, but in true sense, that's a male child. So when you look at an embryo, which is on the fifth day, an XY embryo, it is a male embryo, but it has to go through a transfer. Around 9 weeks of pregnancy, the female reproductive organs undergo regenesis through a hormone called Mullerian hormone. And that hormone, if it is dysfunctional, the uterus and the vagina is not reabsorbed. So even though genetically it's a male, it will have female genital organs. At birth, it is assigned as a female because it looks female. So when you look at the concept, biological sex, they never said genetic sex. Biological sex is a sex assigned at birth. If you look at our historical perspectives of our ancient people, they never used to name people three years of age. Maybe this is one of the reason, or maybe because of lot of infant mortality, they were not naming the child. That can be also one of the reason. Then the next thing is, a person's biological sex is determined on the chromosome status, the hormone status, the environment it lives, and finally the sex rearing of the child. And in this, you have one more concept of gender identity. Gender identity is radically different. It's how a person feels about his gender. It is nothing to do with the chromosomes. You can have a male body, a male chromosome analysis, but that person might feel female. You see a lot of children wearing male clothes and female clothes at the age of 2 to 4 years. We never realize that they're having gender dichotomy, but that is overcome with time. For some people it persists, but we never look at it as an issue. And then we force them to wear the assigned gender clothes, not realizing that needs care and handling. A lot of times a girl child will say, I'll wear my brother's clothes. We laugh it off as a social event, not realizing it's a medical event. And if the child persists over the years, we force them to wear child or throw away the brother's child as soon as he finishes using it. There we are missing a major point of context of an issue. Gender identity starts in a child as early as 2.5 years. By 4 years, they have a reasonably good amount of gender identity. And by 11 years, most of the gender identity is formed. But as physicians, we are not trained in that. Then how can we expect the public to be trained in that? It's a fact. And that is where I adore the Department of Human Genetics for this initiative. Because unless people are educated and aware of a problem, then only the problem can be solved or identified. When the medical provider is ignorant about the concept, then what will the public do? They're helpless. That's my personal opinion. A biological sex is again have another difference called intersex. Intersex is a particular problem which happens due to a hormonal or a genetic abnormality which is partial. So which in turn leads to an ambiguous genitalia. We confuse transgenders with intersex. One thing is intersex is different. That means a developmental sexual disorder, whereas a transgender is completely different. A transgender is an emotional feeling of that person's connect with their body and with their gender, whereas intersex is a sickness which needs management. And the sad part is it's a failure of the medical system to not to diagnose during the intrauterine pregnancy at birth and later, and we are glorifying it as a diagnosis when they become adolescent. That is completely different from transgenders. We mix homosexuality, intersex to transgenders. These are radically different. Then when you look at biological sex, in the first slide, we expect it should have a uterus, testis, like this, the male hormones. But when you look at these species of species, they turn from male to female, female to male during the evolution. That means our definition for mammals is different for birds and reptiles of genetic sex because these guppies can transform into male and female, and similarly the seahorse can take care of different roles, and similarly some of these birds play a role. So what is mammalian sex which produces sperm and egg need not apply to reptiles and birds. So we should clarify when we speak about biological sex and gender identity. And in this, even though it's a particular gender, the environment in which it travels can change the sexual phenotypic appearance, that is the male and the female sexual organs. These are the fundamental understandings we should understand. To give an example, at 6th week, everything looks alike, the male and the female. From 9th week onwards, the whole changes occurs to transform into a male and to transform into a female. And any environment, chemicals or medication can alter this change, and then it turns into a different thing which is more a medical problem rather than a gender problem. This is where we get confused. There is for the sex, there is a predominant role of genetics and hormones, and based on this thing, we assign sex at birth, and we never train the obstetrician to take time to assign the sex. They just deliver the baby, and the nurse tells based on the testis or the vagina, male or female, and the doctor writes it, but never makes an effort to really examine the genitalia. That's a commonplace, and the pediatrician does it. And sometimes 6 hours later, they realize there was a communication error of an abnormality, and then send the investigation. As physicians, we are not trained. Then how can we expect the society to be trained? That's a fundamental gap in the whole world about this problem. That's my personal opinion, and that's my experience. So when the child becomes adolescent, there is an interplay of major hormones in which masculinity and femininity develops, and that depends again on a whole set of hypothalamo-pituitary axis and those genes. And that also plays a role in the adolescent years of developing gynecomastia or sexual developmental issues, which we can say as intersex, sometimes delayed puberty issues, where if there's a delayed puberty, we really doubt the person in terms of characteristics. That's a whole spectrum. We try to confuse all of them. And again, there is another thing where a gonadal failure can come because of injury in the childhood, or there's an undescended testis and the doctor does not identify, and there's a testicular failure. In the male, what happens is there can be injury at the testis level during birth, or there's a failure during the childhood. The testis is supposed to descend from the abdomen into the scrotum. That failure of descent happens and produces a condition called undescended testis. It's the role of the doctor to identify that and correct it so that the development in the adolescent years happen properly. So that we confuse as disorders of sex development, but it's actually a failure of the medical system to identify it. In medicine, we confuse between physiology and failure of system and club them as both. So similarly, if the female has a gonadal failure, she will not develop breast. And when she does not develop breast, her emotions of sexual activity may not develop properly. Then we assign them as independent sex, which may not be right. Then when we go into the gender identity is that person's image, whether that person considers as male or a female, irrespective of its sex. If that person for lifetime feels one particular sex, then they're called true transgenders. There are other group who feel sometimes male, sometimes female. That is what Dr. Deborah was speaking in the slide. And the other group is transitory, which for some time they feel that pattern, but they revert back. That is called transgender dysphoria, which is again a psychiatric problem. So a normal transgender is not a psychiatric problem, but fluctuating thought process of male and female is a psychological problem, and in them the suicide rate is very high. That is what she was speaking in one of the slides. So when you look at transgender male, we assume something different, which I'm going to show an image, and a female, so that we have clarity, because in the name of censorship, when you search for transgender male image, the Google and the Bing are not producing sexual images because they're filtering it as offensive content. Sometimes science is being thought as offensive. In this slide, the average time it takes for somebody who identified abnormality of the gender within themselves, but the time they took to seek attention, by the age of 9 years, it took them quite a long period of time. That means the people who had the problem identified it, but we as a society failed to understand them. By 20 years, the average gap is 14 years of suffering by the child. By 30 years is 22 years of suffering. That means that person is emotionally destroyed, socially destroyed, and familial bonds are also destroyed because the doctor does not understand, the parents does not understand. So that's the crux of the issue. Here is the transgender male. This person underwent hysterectomy to remove the uterus. Then the ovaries are removed, and then a penis is reconstructed, and then a testicular implant is pressed in the scrotum. So this is transgender male. That means a person who's feeling he's a male has been corrected to look like a male. But what we see outside, somebody with a beard need not be a transgender male or vice versa. Our perceptions of intersex and hormonal disturbances is sometimes being confused. Then when you look at the next slide, this is a transgender female who has a normal penis and a testis, for which the penis is removed, the testis is removed, then a vagina is created, and then hormones are given. So your understanding of transgender male or female is you have to look at not the sexual organs but their emotional feelings. And that emotional feelings should be firm for life, they should not be wavering. They identify themselves, and based on that, they take the support of the treatment. So we assume transgender female as like this, but a transgender female does not have the ability to reproduce. We should have this fundamental clarity before we go forwards. That's the reason I took these images, so that I produce clarity. Then finally, there are medical interventions, what Deborah has spoken, surgical intervention. Finally, one thing is, if there's any carry home message in this is, identifying gender identity and biological sex, first by the medical community, then by the scientific community, then by the society at large, will solve the problem. Till then, it will remain an enigma. Thank you, one and all.